Welcome back. February 7th marks National Black HIV/AIDS Awareness Day. Despite advancements in the HIV fight, racial disparities still endure. In 2022, the Bronx shoulders a disproportionate HIV burden with over 30,000 residents living with HIV or AIDS. Joining us to tell us more is Amida Care's Community Outreach Coordinator, Jeffrey Feliz-Ybes. Jeffrey, thank you so much for joining us.
Thank you for having me. I'm delighted to be here and to share my experience.
Yeah, absolutely. So to start off, today marks National Black HIV and AIDS Awareness Day. So can you tell us about the significance of this day and its importance in raising awareness about HIV and AIDS within the Black community?
For me, the significance has to do more with the fact that it took me about 6 years to get tested for HIV. And I can't stress the fact enough that getting tested for HIV should be something that we should all be doing. It took me 6 years. I was diagnosed with AIDS at the time. I had the prognosis of dying, and that was just a life and death situation. Are you going? Do you want to live? Do you want to die? So HIV Awareness Testing Day is very important for me,
Mm-hmm.
especially among the Black and Brown community, because we don't tend to go to the doctors. We don't tend. I mean, like we don't. It is going to the doctors and going to clinics is not the most inviting place
Right.
for us. So I want to stress the fact that it is so important to get tested and to actually find a clinic that you can go to and get tested at.
Mm-hmm. Yeah, absolutely. And the New York State AIDS Institute reports that Black New Yorkers account for 41% of all new HIV diagnoses in 2022. So, can you talk a little bit about why do racial disparities persist in HIV diagnosis and what steps are being taken to address this issue?
I will have to say that I haven't seen enough efforts being taken by the whole entire community,
Mm-hmm.
but I have seen a change. I work with a company, Amida Care,
Mm-hmm.
who is trying to change that.
Yeah.
And Amida Care is trying to get people into care,
Mm-hmm.
trying to get people into their is trying to get people aware, make people aware that they need to get tested and they also need to be aware of their status.
Yeah.
And we're connecting them into care. My primary job is to get people into care.
Mm-hmm.
I love what I do because if I had had that, I probably would not have been diagnosed with AIDS. Um, if I had had someone who said, "Les, hey, I know you're at risk. You are in the high risk factor, and you're in our insurance plan.
Mm-hmm.
Can I get you into care?
Yeah.
Can we bring you to care? What can I do to help you get into that care that you need so you can care for yourself?"
Mm-hmm. Yeah, absolutely. And I think it's so important that you're now taking your story and you're kind of paying it forward with working with Amida Care. But on the basis of that, I also want to discuss that only 12% of Black New Yorkers use pre exposure prophylaxis, despite its effectiveness in preventing HIV. So, can we talk a little bit about the barriers that exist in PrEP utilization, especially among the Black population, and how can these barriers be overcome?
I believe that a lot of black and brown folks, we believe that by taking the medication, it will give you HIV.
Mhm.
As we all know, we, there is not that much trust from the black and brown community in the medical community
Mhm.
because of all the science and all the things that happened prior.
Mhm.
So overcoming those barriers, um, I don't know if we have done enough,
Mhm.
but it requires individuals like myself to say, hey, I'm on these medications. It requires more of us, brown and black folks,
Mhm.
who are positive, who are benefiting from the medication, because I would not be here 13 years later if it
Mhm.
wasn't for these drugs. So I, it just requires more of us to
Mhm.
say the science is there, the science is real,
Mhm.
the science is confirming people like me
Yeah.
living with HIV 13 years later.
Mhm.
So it requires a lot more of our individuals. And that's why I thank you so much for interviewing me
Mhm.
so that I can express this because it requires more of us telling our people that I'm thriving with HIV.
Yeah, absolutely, Jeffrey. Thank you so much for just sharing with us your story and being able to do that. We have about a minute left, but before we wrap, can you just stress the importance of early detection and being on the lookout?
Well, what I want to say is I'm here today because I took that test.
Mhm.
And it was the scariest moment of my life.
Mhm.
And getting the diagnosis that I was positive was even worse. But had I not taken that test, I would not be here talking to you. So, early detection is key. Getting tested is important. Knowing your status, we all have a status, whether you're positive, negative, but being undecided
Mhm.
is not an option
Yeah.
if you want to live.
Absolutely. Jeffrey, I just want to thank you once again just for taking the time to speak with us and stressing the importance of this. I think this was a really important conversation to have. So thank you so much for that.
Thank you so much.
Absolutely. For more information, you can visit their website at amidacareny.org and follow them on Facebook and Instagram at Amida Care.